But now we're talking about treatments of menopause. Now, I am preparing myself for the result from when I went to my doctor. So I start looking at doing some research on what is out there for me because I'm above a certain age. And as I was doing the research, hormonal replacement therapy, or you might hear RHT, or they might have MHT. So it also depends on your symptoms and, of course, your age. Most of these hormonal replacement therapy are actually not geared to women over 60. And this is going back to a study that was done over 20 years ago. And over 20 years ago, a research was done, and it had a wide range of women in this study. Now, they had studied, I guess, from 20 all the way to 60. But the thing is, it was done wrong according to what I was reading, that they just grouped everybody together and gave them a certain dosage regardless of age. But there's other things they should have taken into consideration. Risk factors, is that person hypertensive, if they have a clotting factor, hypertension, diabetes, all of these are risk factors that had terrible effects from that study, which was done 20 years ago. And women who were breast cancer. And then people who were taking this 20 years ago actually just dropped it because they assumed that it caused breast cancer, but there was other contributing factors that will lead up to these side effects and then had a drastic effect on the study. So as I mentioned, this was happening 20 years ago. Now, fast forward it to 2022, then there's more recent studies to debunk what was happening from studies. So these things I'm going to read because there's no way that I could retain them. So I'm just going to give it to you. It's just a little snapshot of what's out there and what you need to know if you're in your 30s and you're starting to go through perimenopause, or you're just hitting the bridge, crossing over to 60. You still have time as long as you're in good health. So again, as I mentioned before, the risk factors was breast cancer. So, and another thing there in the study that affected all of this, and also still now affecting who can take it, is if you had cancer before, if you had breast cancer, and brain health. They're looking now more into bone density. If you have brittle bone disease or anything affecting your skeletal muscles, those will prevent you from qualifying to get these treatments. So basically, everything is dependent on your blood panels. How physically fit are you doing? Because again, a lot of these things may contribute to other factors, but sometimes you have underlying conditions and don't know, and then you take it and exacerbates it or speeds it up. So the hormonal therapy is known as a first line of therapy. This is what's happening now in the new study. So where they're going with these new treatments is to help with hot flashes, mood swings, night sweats, and pain during sex. These are known as vasomotor instability because, again, your thermostat of the body and everything is off. So some of these hormonal therapy will help alleviate this or put these back into alignment. And then if you're under 60 and within 10 years before the onset of menopause, you may qualify, and you have to be in a certain risk factor to be qualified. And then the thing is, the name of the game is that the benefits outweighs the risk. So what you're going through, that's a judgment call. Only you can decide I'd rather take my chances than going through all of this, all the hot sweat and the brain fog and what's my name again? Where do I live? What's my combination? Damn, what's my PIN? Those are the things you have to seriously consider. What is important, because there's stuff like strokes can happen. And again, blood clots. So those are the things you have to seriously consider. I'm laughing, but the thing is, it's serious, but you have to laugh. Body is actually telling us a lot of things. And we need to be honest with ourselves. Can you stand the hot flashes? Can you stand this? Or am I going to try something else, maybe natural? Because there are a lot of natural stuff on the market. And I was reading about one is made from an enzyme, some broccoli that helps with some of these hot flashes. So come on now. If we could get to all the natural things that our foods have, it's an enzyme within the broccoli that helps alleviate some of these hot flashes, and it would be a wonderful thing if you could just get your hands on it. But the thing is, you have to know what's going on, and you have to let the doctor help you through this. But you have to do your homework. And some of the side effects of hormonal therapy is from the uterus. Now, some of these products are made with estrogen. And because of estrogen is given at a certain dosage, it builds up in the uterine lining. It builds up, and then guess what? It's going to come down like period. Wasn't I over that? But that's one of the side effects. But sometimes it only lasts a short period of time. So it usually occurs 4 to 6 when you first start taking, especially the estrogen-based products. And it also helped to increase progesterone. And you also would get breast tenderness. And there is a patch that helps decrease that. And it helps decrease estrogen. So the name of the game is they're going to play with it. Because everybody is designed different. Chemistry. We are not the same. So again, it's going to take a little time for them to find the right combination of things. And maybe you might, with the estrogen patch, they might have to increase progesterone to decrease estrogen. So that's why it takes 6 months. We're going to talk about estrogen. Estrogen is FDA approved, and it comes in a patch, a gel, a ring, and a spray. So systematically, there is one you use that inserts into the vagina. The patch is on the arm. The gel you rub into the skin daily, and the ring is inserted in the vagina and is worn for like 3 months at a time. And of course, you spray it daily on the skin. So that's amazing. And then there's another one I didn't know about also. It's called oral. It's an oral estrogen. But with that comes a little more, it's a little more tricky. And doctors really don't want to play with that because it is ingested. So it has been ingested. It goes into the liver. It goes through the blood. And then, of course, the first thing the blood going to do is going to go to the liver. And the liver is the filter of the body. So it affects the liver. And it also may cause of the blood. And the sad thing about it is we don't know, but there's genetic markers where thrombosis or blood clotting is in the family. Sometimes it has a genetic marker, and you go fool around with that stuff. And you don't want blood clots because it travels. So you need to do a little really genetic workup to make sure you don't have that K factor in the blood. And also, women who has osteoporosis cannot, because again, it helps rise and fall. Also will cause a problem with the bone density. Estrogen is FDA approved, and there is also the cream. There's a cream for the vagina. And again, these things are now custom. They're tailored to your blood type. So again, these are the things you have to speak to your doctor about. And again, here comes chemistry that will help you through this. Another aspect of hormonal therapy is progesterone. If you still have a uterus, this is very helpful, but it has to be coupled with estrogen. And what it is, it helps with hot flashes, headaches, night sweats, mood swings, and vaginal dryness. And it helps with sleep. Again, perimenopause, it starts early. And then you're wondering, oh my God, I'm up because maybe it's a spiritual time. I'll get up and I read the Bible, I read this, I pray. No, it's really your estrogen level messing with your circadian rhythms and sleep cycles off. Don't drink. Don't take more than 2 ounces of liquor or wine, and you're done for a few days. So progesterone will help you to sleep. It helps your sleep cycle. And progesterone, it comes in a spray, cream, patch, but the patch is not approved by the FDA, the Federal Drug and Food Administration. So no, not on the patch. And there's also an injection of vaginal gel and also for the uterus. And the next one is, also it comes in an oral cream and also a soft gel. Testosterone. Now, this is very important because testosterone in the body, that's the one that helps with sexual functioning, muscle tone, and mass. Fatigue, that's tiredness, exhaustion, bone health to improve your menopause. So those are the positive effects of testosterone and also for the hormonal replacement therapy that has these laced in. So it comes in a patches, cream, and compound. That means they'll mix it according to. And good news, it is also covered by most insurance. So some of the things that are on the market and you could look into it. The FDA approved some of these combined cream, the estrogen along with progesterone, plus in an oral substance. And again, there is a common patch. So some of the things I found that are online is Estradot and Clamera, which is an estrogen cream and used in the vagina. And there's an estrogen ring, and which actually can be customized for you. And there is another cream called Thermoplant. It's a transdental cream that you put on your arm or your thigh or your belly. And these are estrogen-based products. And there's also a tablet, which is a sublingual type of tablet that you put it underneath your tongue and it dissolves and it rapidly goes into the bloodstream. And then there is an estrogen cream, which I found that has, I forgot, it's some kind of hydrogen something. It just escaped me. And it's good for under the eyes, for the bags, hydroxide or something like that, whatever. But it helps with the bag and the swelling. It helps reduce. It's almost like preparation H. I don't know, some of you probably still young don't know what preparation H is. That's for hemorrhoids. But also over the years, people discovered that it helps with the swelling of over the eyes and so on. It's works faster than the tea bag. But anyway, that was just a side note. But if you like what you hear, I want you to press like and share, because this information, maybe it might not pertain to you, but it may help someone else or someone else. But that's why we're a community here. We're a community. We're the Signs of Her. And again, we are totally different than our male counterpart. And when you go to your doctor or the physician dealing with menopause, it's to your best advantage. If you're single or you're in a relationship, or even if you're with a partner or marriage, a spouse, whatever, it's best to take them with you to the doctor so they could have more of an understanding. Because sometimes they see us in distress and they're like, what's wrong with her? And the thing is, they have no idea because they're not in the science of her. They're not going through this. Some people don't have that ability to connect either. But once it comes from a physician, and the physician can explain it a little better, then there's more of an understanding. But that's what true love is. True love is an understanding. Just how if we don't have all these in the row, what they say, have your ducks in the row, you'll never have all the ducks in the row. The thing is, you want some of them there. And that's where knowledge comes in. So this is one of the reasons why I invest in now my time and energy, because it's very significant to me. I am getting better and better every day because I choose to get better and better every day. And I'm waiting for the results for my doctor's appointment, which will be maybe in another week or so, to find out where my markers are. Because I know she's going to look at the FH levels. And the thing is, it's done in, I think, 2 consecutive months to determine if you're in menopause. But I know I'm in menopause because it's been so many years. And another thing is, once you start taking some of these, especially estrogen creams, it does cause bleeding, because then the body's going to mimic, hey, I got estrogen. Guess what? Ooh, I'm ready again to go. But that's only for a time. But I like jokes. I got jokes because, again, this is very funny because you have to laugh. You cannot take life so seriously. But if you like this channel, I'm going to say it again, please share it. And in the description, we're going to put a link where we're going to have a webinar coming up, and I'll post a date, and it'll give us a chance to meet on Zoom. It's going to be a Zoom meeting, a Zoom call, and to get to know people and to talk about what's happening in your life. And that's it. And I'd like to say thank you, and I hope this was somewhat helpful. It sure was for me, and I hope at least you get one takeaway from it. And the takeaway is that you're not alone. Thank you for sharing and caring.